Hello and welcome to the Pawsit Podcast. I am Dr. Sam, and with me as always is Dr. Robert. How are you doing?
Hey Sam, how are you been?
I have been good. We've been really busy,
Yeah.
but it's been good. We had a great weekend, just like nice and calm. I didn't have to work, so that was really nice. I know that's not the same for you. Unfortunately, you had to work.
No, I actually thought of you last night, ironically enough, because I had we had three Frenchies all in a row, all intubated in ICU,
Oh,
because none of them could breathe appropriately. And I was like, if only Sam could see this. And two were from the same family. Which
really? What
yeah,
happened?
one got a vaccine and stressed out, and
Oh
then the other one
no.
stressed out because that one was stressed out, and they both came in for respiratory distress. Both were intubated and hospitalized overnight, and I'm sure at least one of them will need surgery today for its airway. But I was like, Frenchies, Sam, and here we are. So,
Yeah.
and then the other one had like a back issue initially, which might be a good segue for our current conversation today.
Oh, well, that works out just perfect because we're going to talk today about I can't even talk. Intervertebral disc disease, or IVDD, which is exactly what Robert was just referring to.
Yep.
So we had some back trauma, I'm guessing. And
Yeah, it was lovely. Back trauma first, and then got stressed out, and then couldn't breathe. So I don't know which one we did first. I wasn't on inpatient that night, but it was a
gotcha.
busy day for that poor dog. So
Well, in case you don't really know what he's referring to, go back and listen to our Frenchie podcast where it talks about dogs with smushy faces because yeah, breathing is definitely an issue with these guys. And I mean, anyone who knows me knows how much I love Frenchies. And did you know that for the first time in 30 years, Frenchies are the #1 dog in the United States? They have surpassed Labrador Retrievers.
this hurts me so much. You have no idea. I mean, I think they're such a fun little breed. They really are. But I think we should consider what Finland does. Finland actually banned. I think it's Finland or Switzerland. It's one of the countries in that area. I'm sorry for being not intelligent about which one it is. I think it's Finland though that banned the actual breeding of them. Like you can't have them anymore. Um,
Any brachycephalics or just Frenchies?
I think just Frenchies. I'm gonna look
But
this
you
up
could have a
afterwards.
pug. They can't breathe. They're worse than Frenchies.
Yeah, but oh well, they're not worse than Frenchies. Sam Dawson. That's not true at all.
Okay, I think maybe it depends on your population. There might be some
Yeah.
population bias because like there's definitely I have seen a lot of pugs lately that are so their faces are so smushed, their eyes
Mhm.
are so bugged, they can't breathe, and they're
Okay.
like, I mean, yes.
I really hope people are watching this video clip today because honestly, the so far it's off to a really good start with the impressions. Um, but yeah, it's probably I haven't seen a single pug actually in the last like year that needed like upper airway stuff. To be honest
Really,
with
that's
you. Yeah,
surprising. I mean, I feel like they're kind of equal, honestly.
for
I just
sure.
am saying if you're gonna ban one, like, but you're gonna allow people to have pugs and English bulldogs. I mean, why ban Frenchies?
No, that's a great point. I'm gonna look into the law and I'll get back on the
Now
next
I want to
episode.
know.
Yeah, I'll look into it afterwards. I'll be like, all right, this is the rules. So, but I thought it was interesting. I was like, now that I heard that was #1, and I was like, oh god, there's going to be
Yeah.
more of them.
Well, and the
So
thing is that it really isn't. I love Frenchies; they're wonderful. My worry is that when the popularity gets up in any breed, I don't care if it's a Frenchie, you know, Dalmatian from 101 Dalmatians,
yeah.
or Marley and Me. Like, he was a golden retriever, right? Like, I
Mhm.
guess the point of the matter is that anytime like a dog breed gets really, really popular, you start having breeders trying to take advantage of that, and
Yeah.
there are some great breeders out there, but there are some that really are in it just for the money and not for bettering the breed. And
Yes.
so then you get into the puppy mills and things like that. And then you have some dogs that start out not the healthiest. And then when you're
Mhm.
like mass producing them, you're probably not getting the best version of them. And so you're going to start seeing more and more like
More and more
bad
issues.
versions of it. Yeah. Which is really
Yeah.
sad because I love Frenchies. I mean, I just love them.
I know you do. God love you, Sam. Uh,
But well, what we're actually here to talk about isn't Frenchies again, although I'm sure we'll get into that again another day. But we're going to talk about disc disease in dogs, so intervertebral disc disease. This is probably one you do see quite a bit, and we kind of touched on it for like a second last week, and we're like, we'll get into it a little bit more depth because it is such a
yeah.
big, important topic, and there's a handful of breeds that are really, really affected by this.
Mhm.
Um, And it's a really serious thing, and it's something I see on emergency in like a day practice, but I'm sure you see it as well too, right?
Yeah, no, we see it all the time. I'm fortunate that I have a neurologist or several neurologists that we work with, so they do it all the time. So we get a lot of referrals for dogs that are unable to walk because of a disc issue. So it's
So
pretty common.
do you like call them right in? Like do if you're thinking, I think this is what this is, like, are you just get neurology, or do you kind of do a certain amount of this workup yourself?
We do pretty much we don't do the MRI. We pretty much get them all set up before the neurologist gets there. So we'll do our neuro exam first, make sure they are actually down because of neurological reasons. And then we'll call the neurologist in after the owner said, yeah, I'm in. And then
Okay.
we'll call them in though. But most of the time we don't have to do it during the night anymore. We try and avoid that when we can, just for the surgeon's sake, so they get to sleep. But there are a few cases where we will call them in ahead of time, like, hey, this needs to go tonight, and we'll get into that, I'm sure, at some point in the podcast.
Yeah. Well, I think it's really important to know so what we're talking about exactly. So, I mean, most people have heard of herniated discs in a person,
Yep.
where disc material, in these cases, it's calcifying, it's becoming hardened, I guess,
Mhm.
and it will extrude out into the spinal canal, causing pressure on the spine itself. There's quite a bit of inflammation at that point as well, too, and a lot of pain. There
Yes.
are two different types of disc extrusions. And so I think it's maybe important to discuss that there are certain breeds that are more likely to get type 1, and then there's certain breeds that are more likely to get type 2. The one that we're kind of talking about more today would be the type 1. So that would be the little dachshunds, anything with a long back and short legs. You know, I don't see it happen in corgis very much, but they are at risk for it.
There are
Um,
risks for it. I don't see it as often, but I do see them occasionally.
yeah.
Yeah.
Interestingly, I do feel like a lot of Shih Tzus, you see it.
Yeah, actually, if you're a little white fluffy dog,
Little
you're
white
pretty
fluffy
high on
dogs.
that list.
Yeah.
Yeah, little white fluffy dogs, you're pretty high on that list.
Yeah, but at least like with them, they do tend to be a little longer than even just like like some of the other little white fluffy dogs. But
Yeah,
you're right, I do. I see it in all the little white fluffy dogs.
yeah,
Beagles, I feel like you see it in.
yeah. They're very vocal about their feelings.
Very vocal, yeah. Kind
Um,
of like, I don't know, huskies, but
okay, okay. There's talking to you. There's a difference. Trying to communicate.
Oh, yeah, they're not at all vocal about
No,
everything.
very stoic creatures. They're majestic and
Yeah.
always.
No, but yeah, so beagles, we see it in. Obviously Frenchies. I mean, we'll see it in
Yeah.
Frenchies. What other breeds do you feel like you're seeing it most commonly?
I don't see it in basset hounds as much as I would
You
think.
feel like you should though, right? But I
I
don't
feel like I
either.
should. I don't see
Yeah.
them as much in basset hounds. Um, Honestly, if you're a little dog in general, you're somewhere on that list because I feel like the little dogs, they tend to have more of the back or neck issues.
Hmm.
For type 1 anyway. So,
Yeah, for
but
type 1,
I think
right?
we hit the big ones.
Yeah. So type 1, we mean just like those are the ones that happen like quickly. Those are the ones that are painful.
Mm,
And the ones where you're gonna usually see um not always, because we do see a lot of back issues where we think it's intervertebral disc disease, but there aren't any neurologic deficits. So
mm,
I've certainly had dogs come in that are extremely painful in their
oh, yeah.
back, extremely, and I think that's one of the hallmarks of this particular thing is it's painful. It's really,
Yeah.
really painful. And it can happen not just in the like the mid back or whatever, but it can happen in the neck as well. So about
Yeah.
15% of the time it's the neck actually.
Yeah. And the neck, though, they're also very painful as well. I think the only big difference is they usually don't have a lot of, most of the time, they don't have neurological deficits to go along with it. Most of the time, it's just so much discomfort. They
Yeah.
can sometimes have neurological deficits, but a lot of times it's just so much pain that they don't want to move because that's how
Oh yeah, it's
painful it is.
awful. And it's I you can kind of guess those rooms too, like just from the history. They'll be
Mhm.
like they're just not acting like themselves. They don't want to eat. Like, you know what I mean? And like
They're
because
shaking.
you can imagine they don't want, it's like they don't want to
Mhm.
move their head, and they don't want to go like put their head down to eat, or and dogs usually can touch their nose to the side of their body, and you just go to run them through a range of motion, and it is like that you've like found it. You're like, okay, I'm cool. I don't have to keep doing this to your poor dog. They're in pain and it's
Oh,
their
yeah.
neck.
Or if they're
Um,
yelping out randomly. I've heard that from a lot of owners. Like, they'll just be sitting
yeah.
there, and all of a sudden they're just yelling for no reason at all. They're like, what happened.
What happened?
And
Yeah, I didn't
a
even
lot of times
touch
that's
you.
neck
Yeah.
pain. Exactly. Neck pain is a big one for the random screaming out for no
Or
reason.
just acting weird. A lot of in veterinary medicine we call them ADRs. Just means ain't doing right.
Ain't doing right.
Ain't doing right. And so those ADRs come in, and I there's a certain history that you hear, and you're like, I wonder if this is neck pain. Like, I wonder if we're gonna find neck pain, back pain, and even though it's different, like a sprained tail sometimes too. Like,
Yeah.
you know what I mean? Like as you're going through, and they're painful. They won't, like, their tails like. We'll talk about that another day. Tail injuries.
Yeah,
But
tail pull injuries.
what?
Tail pull injuries, like those are never fun.
Oh yeah, or swimmer's tail.
Yep.
So what do you, so generally when they get to you though, I'm guessing that you see more of the ones where we're not using our back legs at all and we're totally down, right? I mean, that would be my guess.
I see a healthy mix of both. I would say the ones during the day a lot of times are the ones that are like transferred over because their primary vet's not open. So a lot of times those ones are like hey, this one needs an MRI to find where the disc is, and then potentially surgery afterwards. Whereas the ones at night can be a kind of healthy mix of both. Sometimes they're referrals, but sometimes it's just the dog jumped off the bed at home and all of a sudden they're not using their back legs or they're lame on one of them, and then we'll work it up appropriately.
Yeah, because I definitely feel like, I mean, that we certainly see those. But I will say that if somebody is telling me my dog can't move his back legs, I'm almost always going to be like, well, then you need to go somewhere where like you can get definitive, you may as well just go to the neurologist or something like that, because I always feel bad if they end up paying twice. You know what I mean? It's like you came, I did this, and then you have to go transfer. It's longer, that, you know what I mean? So depending on the situation, sometimes I'm like, ooh, I mean, I'll look at them and I'll do an evaluation, but man, sometimes you just need to go,
I agree. I think that's a really important thing to, like, certain things like back issues where they're not moving their back legs, or respiratory issues. Like if you don't have the facility to do it, go ahead and tell them to go straight to the ER, because those are considered like emergencies. So,
oh yeah, absolutely.
And generally, progression we'll see. Oh, sorry.
No, go ahead. What were you gonna say?
A lot of progression we'll see is like they may start off as pain, but if you're watching your pet, they may start getting like weaker in their back legs. They might start knuckling over, and that's a good sign that it's probably a spinal issue and not like an orthopedic issue. So if you see them like scuffing their paws, or if they're not moving their legs at all, that's definitely neurological, and you need to move ASAP to see a veterinarian.
Yeah, and I think like whenever I get a patient that is coming into me that I've assessed and I've done an exam on, and I'm like, I think it's back pain, I think it's neck pain. It could be a disc. Sometimes, I mean, obviously you have big muscles, that kind of run on either side of you can fold a muscle. It doesn't always have to be a disc issue. But I'll assess their neurologic function. I'll make sure that, obviously they're still walking, so I know that they have motor function, they can move. But we'll check their proprioception, which is like, if you ever see your veterinarian, put a foot upside down and see how quickly it turns over. That's one of the very first things to be affected when your dog is having any kind of infringement on the spinal cord. That lives on like the outermost part of the spinal cord. So if that's not right, like if they don't know where their feet are in the world, that's a first sign that, hey, and that's what, Robert, you're talking about with the
that's scuffing,
kind of scuffing thing. So as long as I don't see any deficits, then I will say to them, okay, we can do medical management. It's totally appropriate. If there's no neurologic deficit, I know they can move, they have motor function, but the like most important thing is that they stay still. Like pain medicine's great. It's going to make them feel better, but that's not what's healing them. What's healing them is time and rest.
Yeah, and I think rest is everybody has their own interpretation of what rest is. I guess I'm curious what yours is, because most time I tell owners, like, and I love our pets, but I don't trust them. And dogs are notoriously dumb creatures. I love them very much, but like they'll see a squirrel, and even though they're not feeling great, they'll go chase it. They'll hear the doorbell and they'll go run towards the doorbell and jump off the couch in the process. That's all instances where they're going to hurt themselves because they're just not thinking. It's like that Pavlov's, ring the bell and they start salivating. It's like a natural response. They just start doing it.
Right.
So I tell owners, like, keep them in a cage, like 3 weeks in a cage. They live in there, they eat in there. You only pick them up to put them in the bathroom with a harness on, and as soon as they're done, you bring them right back inside and toss them in that cage, because
Yep.
otherwise they do hurt themselves, and you're facing yourself with a very expensive surgery if it does
Hmm.
get worse.
Oh yeah. Yeah, no running, no jumping, no like
Mhm.
high impact activity. Yeah, they can go outside, go pee, come back. I don't want them to want to move, and I will give you drugs to help it happen that they don't move too. You know what I mean?
Yeah.
Because I don't want them to be miserable. And, sometimes people will think their dog's in more pain because they're crying if they're being left alone or something like that. It's like, if I can, help out with giving some medications. And usually it's not the very beginning that's the problem, because a lot of the medications we give make them sleepy at first. You know
Yep.
what I mean? So they're like, oh, I'm a little tired. I've been in pain. Now I'm resting. But when they start to feel better, so getting towards the end of that like 2-3 week mark, they feel better. So now they
Yeah.
want to run. They don't know that they're supposed to be resting themselves. And you really can't have that conversation with them like, hey,
Mhm.
not yet. You know
That's
what I
no,
mean?
you think you beat me to it, because honestly, that happens all the time where they'll come
Hmm.
back in. I'll see them maybe a week earlier, a week and a half earlier, like things been going great, and they got out of their cage today just to have some dinner, and they jumped on the bed, and all of a sudden they start screaming again. I'm like, that's because they haven't healed yet. Like, they feel better,
Yes.
inflammation's gone down, but now they're worse.
And
So
now we've just re-injured ourselves, right?
exactly, so that
Exactly.
happens all the time. So
Yeah. And it's also important to know that even with the best management in the world, sometimes their signs just get worse. And
yeah.
I think that it's really important to know what to watch for. So for me, the times where a dog becomes like surgical is if they have intractable pain, like they just, no matter what you give
Mhm.
them, they are painful. It shouldn't be that way. Most back dogs, we call them back dogs or neck dogs, um, you give them reasonable pain meds. It's usually, I don't know what you do, but I usually do a mixture of some form of an anti-inflammatory, so either prednisone
Mhm.
or a non-steroidal anti-inflammatory, depending on the situation. I give
Okay.
them gabapentin, and then
Yep.
I give them methocarbamol. So that's a muscle relaxer. Try to keep them all calm. That's usually what I do. Now, I've had dogs need to have things different for whatever circumstance. Like they can only give liquid medicine, so I have to give
Yeah.
a different version of whatever. You know what I mean? But
Mhm.
but for the most part, those are the three things that I do. And those should work. Like if they're going to work, they should work. And so if
Yeah.
your dog is in pain and it's just not helping, they have to be seen by a neurologist, I think.
Yeah, no, I agree. If you can't control the pain, or they're getting worse neurologically,
Yeah.
those are
And that
reasons to
was
go
that
see
was
it.
exactly right. That was the next thing I was gonna say. Like if then at some point in time they lose motor function, don't
Mhm.
wait until the next day to call me.
Yeah.
If they lose motor function and you notice, go straight to the neurologist and
Yeah.
like think about whether or not you want to do an MRI and surgery, because that's the next step. And if they still have deep pain, that's good.
Yeah.
Their prognosis is good. If they've lost
Yes.
deep pain, unfortunately, it's like a what, 40 to 60%
Yeah, you're
chance.
right. I think it's I think we quote them like 50% within the first
Mhm.
24 hours, and if it's after 24 hours, or
Yeah.
some say 48 hours sometimes, it goes down to like 10%.
Yeah.
So, and that's not chance for them living through the surgery. There's a chance for them to get function back of their limbs and be able to
Right.
walk again. So, like, they'll survive the surgery in terms of their health, but obviously the goal is to get them to walk again and not feel pain.
Especially
Um,
after such an expensive surgery.
yeah, because I mean, depending on the area, like it keeps getting more and more expensive wherever I talk to people. And I was on the West Coast, but like it's a 10 to 12 grand surgery on the West Coast. Like, it is not cheap. And
No.
that's the reason for a lot of pets being euthanized, I'll be completely honest with you. So,
Yeah, I mean, I'm not sure exactly how much it is because the last one that I um, had some complications. So I
yeah,
think that their like bill ended up being higher,
sure.
because they were in the hospital a lot longer,
Gotcha.
which doesn't usually happen. Like I mean, here's the thing, and we could have a whole podcast about this too. Everything can be done right. Every, I dotted, every T crossed. And unfortunately, there are complications. Sometimes things just happen.
Yeah.
And we do the best we can. We make the best plans that we can make. We try to roll with the punches when weird things come up or weird things happen. But you could do everything textbook and, problems can happen. And that's very hard for anyone to swallow, especially when you're talking about, I want to say it's a $5,000 to $7,000 surgery here, but that's
Okay.
not talking about the MRI. Like, I think there's like the imaging first. So I think you're in
Gotcha.
at 7 to 10 grand at the
Okay.
end.
That sounds about right then.
But because I think there's the workup and then there's the surgery itself. So
Yeah, that's about where
it's
we're
not
at.
that far off from what you're seeing where you were at, honestly.
Yeah. And it's just it's because it's a major surgery at the end of the day, and
Yeah.
because you only have, well, I guess you don't only have, there's two main options veterinarians will prefer. Will be either like medical management, which is the medications that we talked about, or the surgical management, which is, and it's hard for owners to, I think, identify when their pet's progressing at home, because you and I know how to test for deep pain. Even I've had some like neurologists or other doctors like assess for deep pain. It's questionable sometimes, but what advice do you give for owners in terms of testing if there's motor, even? Because sometimes I don't think they even notice, like they don't recognize that there's motor. Is there anything you have them look for? Like, because hopefully they're in a cage, right? And they're not moving around. So how do they assess, was my pet just getting worse in the cage? And do I not know about it? Or is there any advice you give to them in those circumstances?
I think that usually they're taking them out 3 to 4 times a day to go to the bathroom, and they're standing them up. So
Yeah.
I'm not like, I don't expect, like, these are all dogs that were painful but don't have neuro deficits. Do you know what I'm saying?
Yeah.
So like, once I start to notice neuro deficits, then I think I probably would have them check them a certain period of time. And
Yeah.
you know what I mean? Because I still think it's appropriate with minor proprioception deficits. I think it's appropriate to try
Yeah.
medical management. I don't think that you're going to definitely progress, or most of the time I haven't seen it,
Yeah.
but there is the potential it can happen no matter what, right? So the fact of the matter is that these guys do need to go outside. Somebody has to be with them. You'll see that they can walk. You'll see that they'll take a couple of steps. But if they can't do that, or you go to prop them up and they fall over, then I think that's you go. You know what I mean? Because
Yeah. I
if you've
agree.
been taking them out 3 or 4 times a day, it hasn't been that long. You know what I
Yeah.
mean? At the most, it's 8 hours. It's not perfect, but I mean, it's not
Yeah.
24 hours. You know what I mean?
Exactly.
You can get somewhere.
Yeah.
That's
And do
usually
you,
right.
and I know we brought up earlier, but I'm curious, what was your differentiation between like using a steroid for an anti-inflammatory versus like a non-steroidal medication for an anti-inflammatory?
So, almost most of the time I prefer the NSAIDs. I usually go that route. Um, because they don't have any neurologic deficits. And so I feel like if they have a neurologic deficit, I would maybe go more towards the steroid. Um, and if it's a small dog that needs like liquid, I just happen to have it, but I don't have a liquid NSAID, so sometimes I'll do it for ease of administration.
Gotcha.
Um, Other times, and I also have liquid gabapentin. You know what I mean? So like, I have things in a different way to be able to give them. The other
Sure.
thing is that the other doctors that I work with, they only do pred. Like, that's what they do. That's
Oh,
just
really?
their
Okay.
protocol. I don't think they ever do NSAIDs. So some of it's a little bit too of like, if it's a dog that's had this before and that's what they've
Yeah.
done and
That's what
it
worked.
worked, I'm probably not
Yeah.
going to rewrite the book. I feel like there's some people that have a really strong feeling about this, like, you should always do this or you should always do that. What do you think? I don't know. What's your
That's kind of
take?
how I think I'm on the same lines as you. I think you and I practice very similar medicine across the board for the most
I think
part, which
so
is
too.
nice.
Yeah.
Not very exciting for a podcast. Yeah, I agree. No,
Well, I mean, to be
well,
fair, we did go to school together, so
yes.
a lot of the things we learned, although I guess really, like, how much you feel like you learned in life versus like what you actually learned from the books in school.
No, I'm just kidding. I learned stuff in school, but I think the value of my internship, I think, I mean, I think your first year of practice, wherever you go, wherever it's an internship, wherever you're at, I think is invaluable. I didn't have a lot of pre-vet school training. Like I wasn't a technician. I
Mhm.
wasn't around animals that much besides my only family pets, and they were relatively healthy pets.
Right.
So I learned most of my stuff in vet school, and I worked in the teaching hospital in vet school, and then I got my internship. But my internship, God, I would have been a shitty doctor if I had not done an internship. I'll be completely honest. Like I did not have the previous experience I think that you did. Um,
Yeah, I was a tech before I went
yeah,
to vet school.
and that's huge. Like that's, I think, invaluable. Like having that pre-experience to then correlate what we learned in school to
Mhm.
what actually matters, I think goes a long way because I did not have that. And yeah, so that's where I learned most of my stuff.
I also think, though, you would never have been a bad doctor because you care and you go out of your way to learn, right? So like,
Yeah.
ultimately, so much of what makes you a good doctor is that you just care about things going well.
Yes.
Um, and then you're smart and you have the ability to learn from the people around you, and you've constantly surrounded yourself with really, really smart people. And I
Oh
think
yeah.
I think that that's good. And I purposely picked a practice that I was like, these people practice medicine in a good way. Like
Yeah.
they've held themselves to a high standard. I can trust that what I'm going to learn or what I'm going to
Mhm.
hear. And like in just talking to them, they would say things that like I had just read or I had just heard at school. And I was like,
Yeah.
okay, then I think even though there's going to be things where maybe I don't do it that way, or, I mean, things work differently in everyone's hands. That's the other thing too. Some of it's just knowing what works when you do it. You know what I mean? Like it's not wrong to do it the other way, but some things
Yeah.
just work better when I do it in a certain way.
Yeah, there's more than one way to skin a cat, right? Not sure that's an
Yeah.
appropriate analogy for a pet podcast, but
You know that I said
oh,
that like not that long ago, and someone was like, "What?" Like they
really?
thought that they were like, "That's a saying." I'm like, "Yeah, is it
Yeah.
just a veterinary saying? Maybe it is. I
I thought
don't
it was
know."
I don't know now. I'm curious. I'll look at the origins of that
Write
later on
in
too.
and let us know. Is there
Yeah,
more
right.
than one way to skin a cat?
Yeah, it's like I think there's actually only one way to do that. So personally, but
Well, yeah.
that this might be a more conversation. But regardless, yeah, but
Right,
I think I
exactly.
choose most of the time steroids for patients that are showing any neurological deficits,
Yeah.
and then I'll do NSAIDs for pretty much any other case. So
Yeah. Yeah.
personally,
If I and I will tell you that I mean, I think I've only ever had one or two patients that have to go and get surgery. And it wasn't even like one of them has had it happen so many times and they didn't even
uh,
come to like us. They just were like, we just went straight to Purdue because they knew exactly what was going on and they knew that
yeah,
the dog was going to need surgery. So I mean, like
yeah,
we had trained them well enough to be like, this is what you watch for, this is what you
yeah,
do, and if it doesn't work, you go. And they're
yeah.
excellent owners who love their dog. And it was a totally weird, got endocarditis. I mean,
Oh, really?
that's yeah.
Huh.
So
That's weird.
yeah, exactly. So it has nothing to do with like the surgeons were great. Like it just was a
Yeah.
weird, like that's why the dog was in. So their bill was definitely a lot higher, but they did
Okay.
everything they could for their dog, and dog's doing great now.
Oh,
Walking,
good.
motor function, everything's good. So
Yeah, and I think that's an important thing. Like, it may look really bad for your dog if they are, or they have progressed to a point where they can't walk anymore.
mhm.
But the prognosis is actually really good for surgery. Like, as long as they can still feel their legs, the prognosis is like 95% for recovery. Like, it's
Oh
really
yeah.
good. It's very
Hmm.
expensive, but it's very good. Your pet can get back to nearly normal, if not normal. Like, they can go back to running, and they look pretty darn normal. Now, the only exception to that, I think, is chronic discs. So if you have a dog that
Hmm.
frequently hurts their back and then eventually just gets bad enough one time where they actually do need the surgery, those surgeries don't have quite the same, I guess, return on your investment.
Yeah.
Unfortunately, it's because the chronic disc material, it's been there for a bit longer. I don't know,
Hmm.
it just doesn't seem to be as effective in those cases.
Well, and sometimes too, they'll have to have several spots, right? I mean, like
Hmm.
that's the other thing too. It's not like it's
Yeah,
always the same disc. Um,
exactly.
so that can be part of it. But then, as far as like we were talking about, there's the other kind too, the chronic,
Yeah.
which is different than the chronic you were just talking about. So you were talking
Yes.
about like the type 1 happening chronically, like it happened
Yep.
multiple times. But the
Exactly.
other type of disc extrusion can happen slowly over time, and that's going to be the big dogs like German
Yeah.
shepherds and older big dogs that happen. You start to see them getting weak in their back end. That's a little
Yeah.
difficult though because they also have a genetic disease that can
Yeah.
happen. So definitely, if you start to see some weakening in your large breed dog, I would definitely talk to your veterinarian about that
Mhm.
because that could be a disc, but it could be something else as well.
Yeah, and I think there's a lot of things. So there's a lot of value to having your veterinarian taking a look at them because again, a
Yeah.
lot of it's, I think, like arthritis. Is there
Mhm.
degenerative myelopathy, which is like a weakness associated with the nerves more than the actual spinal cord.
Having like
Um,
a compression. But this is
exactly.
not as painful. That's what the thing, it happens over
Yeah.
time, and
Hmm.
they're not it's not that the ones that happen that are just like all, they just happen suddenly, and
Yeah.
those are painful. A lot of times people
Yeah.
even say they heard their dog cry out.
Yep.
And so emergency for sure if they cannot walk. I mean, like, I can't stress it enough. I know we said it, but I feel like it needs to be said again, shouted from the rooftops. If they can't walk, get them seen. Don't wait until the next morning. It's worth the drive. Go. If you have a dachshund, just have insurance. So, what is it, like 25%? or maybe more, I don't even know, will have this happen.
Oh
That's
yeah,
1 in 4. That's a lot. I mean,
oh yeah.
that's crazy.
I feel like
So,
Frenchie's got to be close to beating them out by now, though. They got to be really close.
that's so funny because I really only ever seen one Frenchie that has had it. But
Wow.
I know,
Oh my goodness, that's
but
crazy.
we have tons of dachshunds though. Do you know what I mean? Like, so
That's
your
true.
population sample, I do
Yeah,
think, like,
and that's
you are also working at an emergency clinic. We do have a lot
yeah.
of Frenchie patients. They're pretty young though, actually, a lot of our Frenchies.
This is blowing
So,
my mind. This podcast, which is again, that's the whole point of like confirmational bias, right?
yeah.
Like you just where you're at, and in this case, population bias in particular, like what you see every day. That's why it's nice to share stories because you hear what everybody else sees, and but yeah, that's crazy to me. But dachshunds, yes, they are the poster child for
Poster child.
and good
And
insurance.
one thing that I read too when I was kind of just like looking stuff up, just like interesting statistics or whatever about this, is so 15% of the herniated discs are necks, right?
Okay,
But 80% of those 15 are dachshunds, beagles, and poodles.
really?
Yeah.
Huh. Beagles make sense. That
Yeah.
one I'll confirm 100%. It's always next with beagles for some reason.
It is. I agree with you. And I feel like poodles, I'm like, that's so interesting. So are we going to see more doodles now that everything's doodled
Yeah,
with back and neck things?
that's a really good point. Doodles throws because everybody's mixing a doodle with something
I
these days.
know, so many different things. And so you're like, are you either going to get, a healthier dog, or are you going to get like
The
all the
worst.
bad things from both?
Yeah.
I think sometimes you are, right? I mean, that's just
Yeah.
depending on how much work the breeder did ahead of time to make sure they were the best version of both. You know what I mean?
Oh yeah. I think that's it'll be very interesting the next 10 years in our profession in general. But the doodles are kind of blown up the scene probably over the
Yeah.
last 5 to 10 years.
Yeah.
Um,
And I feel like I see so many different things with them, but then again, there's big doodles and little doodles and mini doodles, and you know what I mean? So everything's doodled. And so it'll
it's
be
just a
very
funny
interesting to
conversation.
see. Huh?
Just a funny conversation. It's
Yeah.
like
Everything's doodled.
everything's doodle. But yeah, it'll definitely change things. I'm very curious how that'll affect like the back issues. Because back or neck. Huh.
Yeah.
So
Yeah.
okay.
No, I was just gonna say, but yeah, for sure, your dog can't walk, is in too much pain. Go see Dr. Robert.
Yeah.
Go all the way to
Yeah.
San Diego.
Go San Diego. It's warmer here. It's not bad.
It's
So
true. It's definitely warmer than here because it was snowing.
yep. And I think something we should also talk on is sometimes owners don't realize how sick their dog is or how bad it is.
Mm-hmm.
And they're stuck in a situation where either one, they can't afford surgery, or it's already a bad prognosis by the time we see them. There are occasionally where a dog will literally jump off the couch and they'll go from 0 to 90 and they cannot walk, they cannot feel their legs, and their prognosis is already worse. Part of that reason is because they can have a condition called myelomalacia, which is where pretty much the trauma is so bad to their spinal cord, the bruising and the bleeding from it causes the entire spinal cord to turn to mush, and it's almost always fatal. So that's part of the reason. But also they just get to the point where just they're deep pain negative, where they can't feel their toes, and you can't afford surgery. What do you do then? And I think that's a tough conversation for a lot of people, and I think even for veterinarians, because I don't know, my conversation changes per the owner, to be honest with you. Do you have any, I guess, preferences or anything you talk to owners about in particular?
I've only ever had one owner that he'd had like I think 3 or 5 dachshunds like at one time. Like he had
Oh wow.
multiple dachshunds. And one of them he carried around in a laundry basket
Oh really?
because he couldn't walk. Yeah. So he had like a
Okay.
big pillow in there and he just carried him in his laundry basket. And I mean, the dog was very happy. He wasn't in pain. And he was just gonna kind of like he was able to urinate, I mean, that's one of the bigger things I think that people don't realize is you can have a dog that can urinate, but you can have a dog that you actually have to express their bladder.
Yeah.
And that's like a management thing. So I think you have to talk to the owner and be like, can you keep them from getting pressure sores? Can you keep them from getting urine scald? Can you keep them, it's one thing to have a paralyzed dog. It's another thing to manage that paralyzed dog. Now, a little guy, if they're strong and you can put them in a cart, I mean, that's totally reasonable. But if they're in pain, though, I think I've never had it happen where I've had a dog that was so painful that they needed surgery and they couldn't go do it. Like I have not been in that position. I think if they're in pain and you can't help them not be in pain, that's a quality of life issue. Unfortunately, I think that you do have to consider euthanizing at that point, and that's
Yeah.
awful. And
Oh
those
yeah.
are the most heartbreaking type of situations. But um, man, I hate that because that's fixable at least, even if they had the surgery and let's say they never got full motor function back, but they weren't painful anymore. To me, that would be a successful surgery, right?
Yeah.
Because I've seen some dogs that have chronic neuropathy, like they're weak in their back end after
Mhm.
they have the surgery, but they're not painful and they can get around and they, you know what I mean? So it's like,
Yeah.
was it a successful surgery? I mean, they're not in pain. So yeah, you know what I mean? But
Yeah.
did they get 100% function back? No, but you know what I mean? So I thankfully I've never had that. And this one dog, I mean, he kind of trucked around for a while. He got a little bit of his function back, but he never could like walk again. And there is still a chance, even if they lose deep pain and they have even not a great chance with surgery, if you give them months and months and months of rest and they can get a little bit back. Sometimes they do.
Yeah.
Sometimes they don't though,
Sometimes
unfortunately.
they get like spinal walking, which really isn't walking, but it's like they kind of get some motor back, but
If
it's
they
not
get
like a
up, they can kind of.
yeah, it's like I gotta speak to the neurologist again about it, but it's like a pseudo walking that they can kind of do. But yeah, I think I'm kind of in the same boat. I think it depends on their age too. Like if you have it's always no matter what, like I don't care what the issue is, it's always hard to put down a dog that's really young just because
Yeah,
they're so young.
yeah.
So, but it's a lot of work on the owner at that point because like your options are pretty much to try a cart dog lifestyle or like you said, carry them around all the time, but you're expressing their bladder every 6 to 8 hours. You're watching for UTIs, bed sores, or cart
Mhm.
sores in this case. So it's a lot of work, and for the older dogs, I don't think it's always fair because they're gonna be painful for a while until it goes numb. And it's just tough. So
Yeah,
I
yeah.
think euthanasia is usually better for the older ones.
I think you have to really talk to the owner, and I think it is very hard when you have an owner that can't accept it or won't see it, that they're in pain or they have a lack of quality of life.
Yeah.
Because it's not really our job to sit there and say like you have to do this, but it's our job to kind of like explore, maybe like, well, what do you think is a good quality of life, and you know what I mean? And
Yeah.
um, I do try to advocate for those guys though, for sure, and try to get
Right.
people to see, hey, maybe this isn't right. You know what I mean? But it
Yeah.
is very hard.
Yeah. I don't like those. I mean, no one likes those conversations. They
No.
happen too often, but they're not fun. So
Hmm.
I think
Yeah,
most
and
owners
you
do.
just
Yeah.
really never want to see them euthanizing because they just can't afford the surgery. Like it's a fact of life and it's totally fair. Not everyone has $10,000 laying around to do surgery. It's totally
Yeah.
reasonable. I totally get that. It's so that just stinks. You know what I
Yeah.
mean?
I agree.
So
And that's why myBalto's here.
I was
So
just gonna say that that's one of the biggest things that we're really trying to fix,
yeah.
and we're trying to work on how can we give hospitals the chance to be able to be that hero and say, hey, you know what, we've got you. We've got this fund
Mhm.
that people have given, money, little bits of money over time. And now we have this real fund and we can take care of your dog. So we're working on it. Check out myBalto. We talk about it all the time. I know what that's, we're really passionate about it because we're
Yeah.
really, really trying to make a difference. And this is one of those things, like this is fixable. This is something that is exactly why we're trying to do what we're trying to do. So if you do have any questions, certainly send them to podcast@mybalto.com. We'd love to dedicate a podcast to people's questions.
Yep.
And then also just check out myBalto. Check out how you can help other people save pets' lives, how you can
Mhm.
make money, and let's get the word out because I think we can do really big things. I think we can really, really help animals' lives, truthfully.
Yeah. And actually, you as the consumers can as well. Like as the listeners, like whenever you buy stuff through our platform, you save some money, but the money you actually are using also goes towards other pets in need. So like you're
Hmm.
actually helping just by purchasing things that you would normally purchase anyway. So I think that's a really big thing to you're helping out. So
Hmm.
thank you for helping us help out. That's a big part of it.
Yeah, absolutely. No, we need people to believe in it and come aboard. And I think one
Yeah.
day, like people will be like, you know, this is great, and we've really made a difference. And I'm
Yeah.
excited for that day.
Oh, I can't wait. So yeah, thanks for all you guys listening.
Yeah, thanks for listening. This has been the Pawsit Podcast with Dr. Sam and Dr. Robert.